A very good morning to all my students. I am Dr.Archana Shankar, Assistant Professor working at Vinayaga Mission Shankaracharya Dental College in the Department of Periodontology. So today I'll be taking a class on cementum. So let's see what is cementum. So coming to the components of periodontium. Periodontium is nothing but structures which surround and support the tooth. So we have 4 components. Let's see what they are. The first one, we have gingiva, periodontal ligament, cementum and alveolar bone. So I will be covering about cementum. So what are we going to study in cementum exactly? So let's see the contents. Contents are what and all is being included in this chapter. Coming to the contents of cementum, we have to see what is cementum, various physical characteristics, the chemical composition of cementum, the cells of the cementum, cementogenesis, it's nothing but how the cementum formation takes place. What are the functions of cementum? What are the cemental diseases or cementum anomalies that are commonly seen? Age estimation of cementum. So these are the topics that will be covered in today's class. So cementum. So as you can see in the picture, what do you guys see in the picture? You have the tooth structure, you have enamel, and you have the cementum also shown. So enamel, you can see it in white, and above that you can see the root structure. So root is covered by cementum. So what exactly is this cementum? So cementum is a structure, or it is an avascular and non-innervated structure which surrounds the root of the teeth. Leave the crown portion. Crown is surrounded by enamel, or crown is covered by enamel. Cementum covers the root portion. Okay, so it is avascular and non-innervated. So as you can see in the diagram, so cementum starts from here. It goes around the root and it ends here. So this is where the cementum extension takes place. Right from the cemento-enamel junction. This junction, the junction between the cementum and the enamel is called cemento-enamel junction. So it extends from here, goes all along the root side and then covers the entire root. So this is what I've been talking about cementum. It covers the roots of the teeth. It is avascular and non-innervated, and it begins at the cemento-enamel junction and then continues up to the apex of the tooth. So look into the diagram, dear students. You can see a small portion of the root. Now look into the diagram carefully. I'll show you what exactly is happening. This structure is the pulp. This light yellow is dentin. This is the pulp. This is dentin. This is the cementum. So you have pulp, dentin and cementum. Now cementum, you see, it covers the root of the tooth and it extends even covering the apical foramen. As you all know, you would have studied in first year. Apical foramen, you know what it is. It is a small opening seen at the root tip. So what happens is this cementum covers the apical foramen also. And look into the diagram again. This extends some distance into the dentin. Understood? So it actually surrounds the tooth on the whole. It covers even the apical foramen. Coming to the physical characteristics of cementum. How is cementum physically? Okay. So coming to the color. Now color of cementum, if you take, it is light yellow in color. Now dentin is also light yellow. So it is even more lighter when compared to dentin. How can you differentiate cementum from enamel? Actually, enamel is a very lustrous covering of the crown. Cementum can be distinguished from enamel by the lack of luster and its darker hue. But it's not possible to differentiate between cementum and dentin based on color alone. Coming to the hardness, it is less hard when compared to dentin. Coming to the chemical composition of cementum. What is the cementum made up of? It contains 45 to 50% of inorganic substances and 50 to 55% of organic substances and water. So inorganic portion, it mainly contains hydroxyapatite. Hydroxyapatite is nothing but calcium phosphate. Organic substance is mainly dealing with collagen. So it has hydroxyapatite, which is nothing but a combination of calcium and phosphorus. And organic material we have collagen, and mostly it is type 1 collagen. So let's see the cells of the cementum. See, any tissue in the body has to be made up of a few cells. Let's see what the cells are. Cementum has 3 types of cells: cementoblast, cementoclast, and the cementocytes. Now, I'll tell you an easy way to remember blast and clast. So usually, just think of bomb blast. So what is happening when an area has a bomb blast? What exactly happens? There is total destruction. But when it comes to cementoblast or any structures pertaining to the tooth structure, blast means something which is forming. It is exactly the opposite of what is happening like bomb blast and all. No, it is just the opposite of that. So cementoblasts are cementum forming cells, but cementoclasts are cementum destroying cells. Clast will destroy, blast will form. So next cell is a cementocyte. So I'll show you the picture of a cementocyte. Look into the diagram. See the first and the second one. Now first one, I'll tell you what cementocytes are. Then you will understand by looking at the diagram. As I told you, cementoblasts are cementum forming cells. Once their role is over, these cementoblasts will go and rest in certain places called lacunae. Look at the diagram. Can you see those oval shaped structures? Those are called lacunae. So the cementoblast will go and rest in those lacunae, and once they rest, they become cementocytes. Those become the cells of the cementum. So cementoblasts, after formation, they will go and deposit themselves on the surface of the cementum in tiny spaces. Lacunae are nothing but small spaces. So they rest in all those spaces which are called lacunae and transform themselves into cementocytes. Now look at the diagram again. There are small finger-like projections. I'll show you now. See this? Did you all appreciate the finger-like projections? These finger-like projections are called canaliculi. So cementocytes develop canaliculi. Now what is the function of these canaliculi? In the next image, in the image next to it, you will find the microscopic version of canaliculi. They are nothing but all finger-like projections or brush-shaped projections arising from the cementocytes. So their main function is, as I told you earlier, cementum is avascular and non-innervated. So how does this tissue retain its vitality, or how does it get its nourishment? It's mainly from these canaliculi. They bring in nourishment for the cementum. They get their blood supply from the PDL. So that's how they are being nourished, because of these canaliculi. They are all finger-like projections which keep extending like this, and they draw nourishment from the adjacent periodontal ligament. So these are the lacunae, or these are the lacunae in which the cementocytes lie, from which canaliculi or finger-like projections keep deviating. So our next heading is thickness of the cementum. So let's see the thickness of the cementum. We'll see where and all it is thick, where it is thin. So cementum is very thin at the coronal half of the tooth. Coronal half means near the enamel. Coronal half of the tooth. It is very thin. It is about 16 to 60 micrometer. Cementum is very thick towards the apex of the root. It is around 150 to 200 micrometer. So see, 16 to 60, and this is 150 to 200 micrometer. It is thick towards the apex of the root and also in the region of furcations. Furcations are mainly seen in multi-rooted teeth like molars. Cementum is thicker in the distal aspect. So see, where all cementum thickness varies. Coronal third, apex and furcation, and it is even thicker in the distal surface. There is a reason why cementum is thick on the distal aspect of the tooth. So once you get into clinics, you will get to know what is the reason. Once you see a lot of patients, you will get to know about tooth mobility, physiological tooth mobility, migration. So because of all this, the tooth has a tendency to migrate mesially. So that's how the cementum deposition happens more on the distal surface and the thickness is more on the distal side. So coming to the classification of cementum. Now every tissue if you take has a classification. Okay. So it's very common in dentistry to have classifications for various topics, and cementum is one such topic. So cementum can be classified based on the time of formation, based on the number of cells, based on the presence or absence of fibrils, based on the origin of collagen fibers. So this is Schroeder's classification. Now, when I said classification, the first point that I said was based on the time of formation. So under time of formation, we have primary cementum and secondary cementum. Based on cellularity, we have acellular cementum and cellular cementum. Based on the presence or absence of fibrils, we have fibrillar cementum and afibrillar cementum. Based on the origin of fibers, we have extrinsic fiber cementum and intrinsic fiber cementum. Based on Schroeder's classification, actually that is the most widely accepted classification. It came into practice, or it came into existence since 1986. Under this we have acellular extrinsic fiber cementum, cellular intrinsic fiber cementum, cellular mixed stratified cementum. So let's see what is acellular cementum. From the name itself, acellular means no cells. A means no. Acellular cementum has no cells. So such type of cementum is mainly seen in the cervical third of the root, and in this case Sharpie's fibers are very well mineralized. So let's see where acellular cementum is commonly present. So I'll show you a diagram. On to the diagram please. Consider this to be a root structure. This is the cervical portion. This is the apical portion. So acellular cementum is present here in the cervical third of the tooth. Now this acellular cementum is also called as primary cementum, and in this kind of cementum you find Sharpie's fibers well mineralized. So if you ask me what Sharpie's fibers are, they are nothing but they are the principal fibers of the periodontal ligament. On to the diagram please. So this is the bone. This is the periodontal ligament. So Sharpie's fibers are nothing but these are the terminal portions, or the ends, terminal portions of the fibers of periodontal ligament which get embedded into the cementum. Okay, these are the periodontal ligament fibers. They get embedded into the cementum as well as to the bone. So here you find Sharpie's fibers very well mineralized. We'll see what cellular cementum is. Now I told you in the previous slide, acellular cementum is mainly present in the cervical 1/3 of the tooth or the tooth root. Cellular cementum is present in the apical 1/3, exactly opposite. Acellular cementum, cervical 1/3. Cellular cementum is mainly present in the apical 1/3. So acellular cementum is called as primary cementum. Cellular cementum is known as secondary cementum. There Sharpie's fibers are well mineralized. Here Sharpie's fibers are not very well mineralized. This type of cementum forms after acellular cementum. So first we have the acellular cementum formation, and then comes the cellular cementum formation. So in cellular cementum, there's something called incremental lines or incremental lines of Salter. It's called Salter because Salter was a person who has done a lot of research on this incremental lines. They are nothing but alternate light and dark bands. I'll be showing in the upcoming slides. So these incremental lines of Salter, they have to be very close to each other. But what happens in this case, cellular cementum? They're all widely placed apart. Look onto the picture. They are widely placed. They have to be very closely placed. Again, look into the picture. So now can you see the difference? In cellular cementum, incremental lines of Salter are placed really wide apart. So, as I was telling earlier, what are these incremental lines? These are lines which appear as dark bands under a microscope. Microscope means once you grind the tooth surface, fix it on a slide and then keep it under microscope with certain staining, you will be able to see the dark bands or dark lines of the cementum. So what do they signify? They are nothing but periodic deposition of cementum. Cementum is not deposited like this as one bulk. It happens in layers. First one layer will be formed, then you have another layer of cementum deposition, on top of that another layer. Periodic deposition of cementum. Incremental lines are nothing but periodic deposition of cementum, one above the other. Now coming to acellular, afibrillar cementum. From the name itself, acellular, no cells. Afibrillar, no fibers. I told you there are two fibers, extrinsic fibers and intrinsic fibers. So afibrillar, no fibers. They are mainly a component of the ground substance. It does not contain any cells and fibers. Now we will see what is acellular extrinsic fiber cementum. So from the name itself, acellular, this does not have cells. Extrinsic fibers are seen, means fibers outside are seen. Acellular extrinsic fiber cementum. So extrinsic fibers are seen which are perpendicular to the tooth surface, and this kind of cementum extends from the cervical to the apical, 1/3 of the root surface. So acellular extrinsic fiber cementum. So this kind of cementum is mainly seen in single rooted teeth. So this is a microscopic appearance of acellular and cellular cementum. On to the diagram please. This is the dentin. This is cementum. See this layer? It is devoid of cells totally. So it is called acellular cementum. Look into the diagram again. This portion, it has cells. So that becomes the cellular cementum. There are other types like cellular intrinsic fiber cementum, cellular mixed fiber cementum, cellular mixed stratified cementum. So from the name itself, cellular intrinsic fiber cementum, it has cells, it has certain intrinsic fibers. Cellular mixed fiber cementum, it has a mixture of both intrinsic as well as extrinsic fibers. Cellular mixed stratified cementum, it has cells, it has a mixture of both intrinsic and extrinsic fibers, and it's all stratified. What is cementogenesis? Genesis means formation. So cementogenesis, we are going to see about how the cementum is formed. So what do you see in this video? You see a crown structure which is covered in a bony crypt. What you see there is a crown with enamel. Now see the cervical portion. You will find a small extension. That's nothing but Hertwig's epithelial root sheath. It will extend and it will bend inwards. So this Hertwig's epithelial root sheath is a bilayered structure. Bilayer means it contains two layers of epithelium, as you see on the slide. See the video properly so you can appreciate it. So from the diaphragm or from that loop, that curve is there, no, it will send signals to the ectomesenchyme, and then dentin is formed. Can you see that orange color formation? That's nothing but odontoblast. So from the end of the diaphragm, signals are sent to the tooth, odontoblasts are formed, odontoblasts form dentin. Hertwig's epithelial root sheath is a bilayered structure. One layer just goes off. Before the second layer can go, again signals are sent. Can you see those wavery structures? Those are the signals. Signals will be sent, and then all those purple color structures are the fibroblasts or the extrinsic structures. which will get attached to the cementum. Those green ones are the cementoblast. So you have the fibers as well as cementoblast. Cementoblast will form the cementum. Okay, so we've seen how cementum is formed. Now coming to the functions of cementum. Just 3 functions: anchorage, adaptation, repair. So what do you mean by anchorage? Anchorage is nothing but this cementum furnishes a medium for the attachment of periodontal ligament fibers. I'll show you the diagram. So what you see is the root surface. So what are these structures that I drew? They are nothing but the periodontal ligament. This cementum furnishes a medium for the attachment of periodontal ligament fibers. So hence it helps in anchorage, anchoring the periodontal ligament fibers so that it stays proper. The tooth is not floating. Periodontal ligament fibers get attached to the cementum on one side and bone on the other side. Hence cementum plays a role in the attachment or furnishes a medium for the attachment of the periodontal ligament fibers. That's anchorage. Now adaptation. What is adaptation? Adaptation is nothing but, for example, you take maxillary and mandibular molars. Due to some reason, you have lost your maxillary molar. As you know, the teeth should stay in occlusion, right? Maxillary teeth and the mandibular teeth, they have to be together, they have to occlude. So just look at me, maxillary molar is not there due to some reason. It has gone. So what will happen? Once it goes like this, once the tooth is not there, this does not have an antagonist. This will be empty. Only the tooth will remain. So what will happen? This tooth, which is alone, will try to move upwards. So when the tooth is moving upwards, what will happen? There is excess deposition of cementum at the apical region, means at the ends, or even at the sides also it can take place, mostly at the ends. So this is called adaptation. It adapts to the surrounding, because as this moves up, the entire tooth will appear a little lifted, but still cementum will be more in the apical region. I'll show you. Move on to the diagram. For example, imagine this tooth is migrating upward because of the absence of the antagonist. There will be more deposition of cementum here. This is adaptation. It just adapts to the surrounding. Next is repair. By chance, if a layer or a portion of cementum is chipped off, quickly they can repair themselves. Understood? So this word itself you can understand, repair, means it has the ability to repair. Anchorage, adaptation, repair. Okay, so we've seen so much about cementum. Now let's see what are the junctions of a cementum. Where and all the cementum goes and attaches, and with what it establishes its bond. Those are the junctions. Junctions are of 2 types: cemento-dentinal junction, cemento-enamel junction. Let's see what cemento-dentinal junction means. Okay, so what you see in this picture is the cemento-dentinal junction. Look at the diagram carefully. What I marked is cementum. This is the dentin. So this establishes a junction, a bond. Cementum binds to dentin with the help of cemento-dentinal junction. Next is a cemento-enamel junction. From the name itself, cementum and enamel. So cementum enamel form a junction. They form a small bond there. So let's see what are the types coming under cemento-enamel junction. There are 3 types. Now in 30% of cases, the enamel and cementum meet at a point. Cemento-enamel junction. They meet at a point in 30% cases. In 5 to 10% cases, the cementum and enamel don't meet. There will be a small gap between cementum and enamel. In 60 to 65% cases, if this is enamel and this is cementum, the cementum overlaps the enamel to a certain distance. Okay, so one will meet at a point. The second type, it doesn't meet at all. Third variant is, in about 60 to 65% cases, the cementum will overlap the enamel to a small distance, not completely, a very small distance. Now, coming to age estimation using cementum. It's nothing but we can find the age of a person, age estimation using this cementum, you would have studied Gustafson's method of age estimation. So even using cementum, this can be done. So what they do for age estimation? They take the tooth, they trim it, they grind a little, means they section a little, place it on the slide and view it under a microscope. So when you take the tooth and then slice it, and when you see under the microscope, you will be able to see the appearance of what is shown in the last picture. Just follow those arrows, taking the tooth, grinding, keeping on a slide, and then that's the final appearance with all those cementocytes and acellular cementum. You will find all that. That's how a cementum looks under microscope. Now how do you estimate the age using cementum? Let's see. So this is how age estimation using cementum is done. Now watch the first picture carefully. So first picture, what have those people done? They have measured the length from the cementum to the dentin. Look at the picture, please. This distance is measured. This is cementum and this is dentin. So the entire length from cementum to dentin is measured and is called X. See the next picture. The distance between two incremental lines is taken. See, all you will find incremental lines like this between cementum and dentin. So first this was taken X. Second, you are taking only distance between these two, okay, or any two incremental lines, and it is termed Y. So you got X, you got Y. So there is a formula to calculate this. N is equal to X by Y. You calculate that. And using a formula, E is equal to N plus T. E is equal to N plus T is a formula that you are supposed to use. E is nothing but the estimated age. N is the number of incremental lines, that is X by Y. T is nothing but the erupting age of the tooth. So once you do all this calculation, you will get the, you can estimate the age. So coming to age changes in the cementum, what will happen as the years go by? There can be increase in width. It will increase in width altogether, either at the apex, more in the apical region, and even towards the sides also you have a slight increase in width, but mostly in the apical region. You can also find resorption taking place. So age changes of cementum are increase in width and resorption base. Okay, so we've seen a general introduction about cementum. We've got a lot of information on what is a cementum, its various functions, how it is being formed, etc., etc. Now we'll see what are some of the anomalies that can affect a cementum. We can't call this like disease, certain like developmental anomaly. What can happen to a cementum? So first one is concrescence. So what do you mean by concrescence? Concrescence is nothing but union of two teeth by the cementum alone. You can come across cases like this in your clinic. Once you attempt some extraction, no? You will be wondering, why is extraction so difficult? There are many reasons as to why extraction can be difficult. So the two teeth will be adjacent to each other, but they would have fused. That's called concrescence, union of teeth by the cementum alone. That is a developmental anomaly. Next is hypercementosis. Hyper means what? Increase, extra, excess. Excess cementum, hypercementosis. So as you can see in the radiograph, these are not clinical pictures, these are radiographs or X-rays. You can find, see cementum formation excess in the apical region. Please look into the radiograph. See this? This radio-opaque structure. Radio-opaque means, completely white. Here also, see, so much cementum is being deposited. So this is hypercementosis. Cementum tears. As I told you earlier, it's nothing but a small portion of the cementum gets fragmented, but this cementum has the ability to repair that also. Next, we'll see some common tumors affecting the cementum. Tumors can happen in the oral cavity also, but even, a component of the periodontium can also suffer from tumors. So coming to the tumors, we have cementifying fibroma. See, this is the clinical picture. See, with respect to premolar, molar region, You can find one small elevated structure there. So this can be cementifying fibroma. It can be something else also. So how will you confirm that, okay, this is cementifying fibroma? For confirmation, we need to take a biopsy and then send it to the lab. Even oral pathology can do a biopsy and they will come to a conclusion. Any elevated lesion in the oral cavity is not cementifying fibroma. It can be anything. It can be any even fibroepithelial polyp, pyogenic granuloma, various differential diagnoses are there. So before you confirm the diagnosis, you need to take a biopsy and then oral pathologist can confirm the diagnosis. So this is the clinical picture of a patient. Now see the radiographic feature. This is an OPG. OPG means orthophantomogram. You get to see the entire maxilla and mandible. Just look at that area. It looks like one big cotton ball, fully white and radio opaque. Radio opaque means any white structure. So this is a tumor which can affect the cementum. Next is cementoblastoma. We saw cementifying fibroma, now cementoblastoma. This also looks almost similar. See the tooth structure, see the molar, one big cotton ball attached to one of the roots. So even it's a very difficult case to extract, because you have to extract the tooth along with the calcified mass. You will come across such kind of cases in your practice. So it is said that once the tooth along with the calcified mass is removed or extracted, chances of recurrence is very less. So we've come to the end of the class. As I said, cementum is one of the components of the periodontium. Like gingiva, pedial, alveolar bone, cementum is also one of the components. Now all these three will not act separately. They all act together as one functioning unit. Apart from this, cementum can furnish a medium for the attachment of periodontal ligament fibers. It is avascular, non-innervated. It surrounds the entire root of the tooth, beginning from the cemento-enamel junction, continuing up to the apex of the tooth, even surrounding the apical foramen. So that's all for today's class. I hope you have enjoyed the class as well as understood something. You have to take over some points. At least 10 important points should be there in your head after this class. So hoping to see you all soon, and thank you so much for the patient listening. Thank you once again.